The majority of the population is vaccinated under government guidance with Pfizer and Moderna vaccines. Vaccinations have been administered almost indiscriminately in Japan, and since 2021, it has been administered first to healthcare workers and then to the elderly. 80% of the population has been vaccinated twice, and of these, 60%, or rather 70%, 3 times. The vaccine was then continued for another 4, 5, 6, and 7 times, but with each subsequent dose, the number of people getting vaccinated decreased. In these circumstances, doctors began seeing patients with so-called turbo cancers, a type of cancer that progresses at a very fast rate, which doctors had never experienced before, and which was already in stage 4 when it was detected in medical visits. So the doctors began to share information about how this type of tumor was different from those seen previously. This is what happened last year and the year before. Doctors could sense in the field that something unusual was happening regarding cancer. After all, what happened here is that vaccinating a lot of people, the number of people who have been vaccinated is much higher than the number of people who have been infected. The number of infected people is approximately tens of millions, while the number of vaccinated people is almost 100 million. So even in this case, the vaccine cannot be ignored as the cause of the problem. From the results of this analysis, it emerges that surprisingly, in relation to vaccination, some types of cancer appear to be associated with an increase in deaths. Breast cancer, ovarian cancer, pancreatic cancer, and then head and neck tumors, nasopharyngeal cancer, and of the oral cavity, And so another is prostate cancer in men. These tumors specifically cause an excess of deaths. I believe that this phenomenon cannot be explained in any way by artificiality. That is, by the fact that the pandemic prevented people from undergoing early screening or missing the opportunity to receive treatments. As shown in the first graph of the article, excess deaths occur after the third vaccine dose and not at the time of the pandemic in 2020. It cannot be explained in any way that the excess deaths occurred because people were discouraged from seeing a doctor. That is, they wanted to be examined by a doctor but were not examined, or they wanted to undergo surgery but they were not able to do it. Data shows that excess deaths occur after the third or fourth vaccine, even after the first or second. 2022 is the year in which the increase in deaths became significant in terms of the general trend. Trends show that cancer deaths have decreased year over year. It was definitely declining. And between 2021 and 2022, it flattened. In 2022, it is evident that the trend, which was rapidly decreasing, it has been vanishing. As this figure clearly shows, the excess of cancer deaths is particularly pronounced after the third or fourth vaccine. So from this data, what about this excess of cancer deaths? We have to question the vaccine again. This could, of course, be due to the vaccine releasing spike protein, as well as various other causes. IgG4 antibodies are formed, which interfere with immunity against cancer. There could be many other explanations. One in particular is, as I said before, cancers such as leukemia, breast cancer, ovarian cancer, prostate cancer. These tumors are due to estrogen receptors. We know experimentally that estrogen receptors are stimulated by spike proteins. So the type of tumor that grows when the spike protein stimulates the estrogen receptor is exactly the type of tumor that is causing the excess deaths identified here. I adequately highlight this in the article. In fact, in October, when vaccination began in 2021, I proposed in my article to register all cases because I thought that by continuing this vaccination, there would probably be problems in the future regarding autoimmune diseases, neurodegenerative diseases, so such as cancer and infectious diseases. But when it comes to this point, we believe it is necessary to have a more precise picture of the real situation.